Hello and welcome to my presentation. My name is Rashida Joquin. I'm a graduate student at Salisbury University pursuing a degree in social work. I am also a CUSP scholar for the very first time for the very first year, and I'm very excited about that. I'm very happy with my project as well that we were tasked to work on. So my leadership change project was more focused on self-care in the workplace. So initially, my focus was more on the mental health preparedness of the incoming staff at Brook Lane. But as the year progressed, I realized that there should be more focus on self care. I had asked myself, there is a need for support for incoming staff, but what about the staff already employed? So as the semester progressed, or semesters, I started to feel burnout in my work life, in my school life, personal life, and I realized that this is more of a topic that should be addressed. As I was talking with some coworkers, I noticed there was a trend between newer staff and staff that have already been employed with the agency for more than 3-4 years. And I noticed that the staff that have been there longer tend to kind of dissociate a little bit, and you can see more of a burning passion, and those who are more driven to address issues were from newer staff. So I was trying to see what was the correlation or what was the background between the two. So, what was I hoping to achieve? I was hoping to provide the staff, all staff at the Laurel Hall School located at Brook Lane, with resources in order to address self care. I wanted to promote support or show support for fellow coworkers. I wanted to offer outside support to help with any problems they may have. And I also wanted to provide basic information to give an overall understanding of signs of burnout, compassion fatigue, and provide tools to promote a healthy lifestyle. So, what were my assumptions? So, although there is a need for more information supplied to the incoming staff, the current staff employed do not practice self care as much as they should, especially considering what our job entails and what the actions or the tasks that we're supposed to do on a daily basis. And I also noticed that not all staff practice self care or understand that we can experience more burnout and not really realize it. So, what exactly did I need? I needed to find the resources already available for the incoming, or not incoming, but the staff already employed. I needed to reach out to human resources to understand better the support that was introduced from the initial the contact between employer and staff. So usually during orientation, they'll let you know of the resources available for you in regards to mental health or your own mental health. I also needed to cover the general background knowledge that will lay the foundation for individualized growth. So my experience with working with HR, it was an opportunity to practice advocacy, which we have learned more in during our social work career or educational career, and just understanding to advocate, with our clients, patients, anyone. So I wanted to use that form of advocacy or that opportunity to advocate for my fellow coworkers and my fellow peers. For me, that was very much an experience. I felt very fulfilled being able to get the courage to talk with, higher ups and have that conversation of wanting to be a support and advocate for a topic I felt passionate about. Very common theme we've also learned during my social work educational career is the code of ethics. It's basically our Bible within the program, but two of the core values that was very prominent when I was working with HR was the importance of human relationships as well as the dignity and worth of the person. So the stakeholders involved, the main stakeholder in this particular population was the EAP, which is the Employee Assistance Program, which is offered offered through Meritus. So in that partnership, they have some therapy sessions that are free for the employee. They have brochures and classes you can take as well to get a better understanding of your own mental health and what you can do to address those needs. and provide, the therapists that are completely anonymous, like your information won't be shared anywhere. And if you want to continue with your therapist of choice, you have like the insurance that will cover some of the cost um, at Meritus. So one of the topics I wanted to cover was burnout. I learned this through the information shared through the EAP program. So burnout is the state of emotional, mental, and physical exhaustion. It's usually found within the workplace, but it's not limited to just that. Burnout is the result of feeling overwhelmed, emotionally drained, and having struggles in meeting daily demands. Another topic that I wanted to discuss as well is compassion fatigue, which I did not have much knowledge about initially. So, compassion fatigue is the prolonged effects of burnout, stress, and moral distress that are not addressed. Unaddressed burnout can lead to depression, anxiety, post traumatic stress disorder, and obsessive compulsive disorder. Compassion fatigue can be visibly seen in everyday lives, which could be how we interact with our family and in our workplace. The preventative steps that can be taken to prevent compassion fatigue is balancing your life. So, getting to bed at a decent time, exercise, journaling, setting boundaries, eliminating negative coping skills, which usually would pertain to, after a long day of work, you just want to, consume a beer or something along those lines. So, just finding healthy ways to cope. So, what exactly did I do? I worked with HR to create a pre-survey and post-survey that consisted of questions in correlation to self-care. In that pre and post survey is just to collect data to compare and contrast the difference from newer staff and the staff that have tenure or staff that have been there over a period of time. In between surveys, I created 5 separate PowerPoints that consisted of information about self-care, positive self-talk, understanding burnout, how is COVID currently affecting our mental health, and what exactly is compassion fatigue. These PowerPoints were then uploaded to the Reliance training program that we use at my place of employment. So some sample questions that I used were just asking for the pre-survey, just asking basic background information like age, how long you've been at the agency, what's your ethnicity, what's your race, your racial background, and if you practice self-care or do you know what self-care is. After the presentations were uploaded, then the post survey, was then sent out as a follow-up, asking questions if the individual learned anything from the PowerPoints and if they will or if they will practice self-care now that they learned that information. So what was the end result? So after everything was said and done, I went more of a one-on-one just to ask what everyone thought of the information that was provided. I didn't really disclose that it was me that created it, just to alleviate some bias in their answers. And I went around and asked roughly about 10 staff their understanding or how they felt about the information that was shared. And for the most part, the majority of the responses were positive and how they would try to practice more self-care and how the information were useful. A lot of them said they didn't remember about, the EAP program that is available for them and that they would look into actually getting the help. These are my resources. And that's it. Thank you so much for listening to my presentation.